I'm Shannon Elk. I am the supervisor for the cardiology clinic, this cardiovascular surgery and thoracic surgery clinics, and pulmonology clinics. Today I'm going to talk to you about our project, Dear Doctor, Are You Listening? It all started out when our team we were trying to identify an opportunity for improvement within our clinic, not only with patient experience, but also just communication and kind of workflow for the clinic all in general. So our team identified that potentially offering a note to patients so that they can kind of write down their thoughts before they visit with the providers. That gives them an opportunity to not only feel like they've been heard when the provider reviews that. It also gives an opportunity for nursing to give that appearance of also caring and putting in the time to make sure that all of your concerns and questions are addressed during your appointment. And then currently our teams are sharing these forms, and we give them out to all of our patients at every patient exam. One thing that our team also identified is that they really wanted to see maybe topics listed on the sheet so that the patients might kind of be prompted for different types of questions. For example, and you'll see on my PowerPoint here, it talks about health questions, medication questions, if you need any medication refills today, or test or procedure questions, just to help them prompt and be kind of aware of things that might spur some questions or concerns that they'd like to visit about with the provider that day. Through offering the Dear Doctor form to our patients, we'll improve our patient experience and also in the ways of communication between our provider and patient and our nurses and patient, and create a better and thorough exam for that patient that day and make that appointment worthwhile for that patient. My outcome metrics, I wanted to achieve a 5% improvement in the improved communication between patients and providers, and I wanted to do that by the end of October. And my process metrics was to offer that Dear Doctor form to each patient at each clinic appointment, trying to gather those opportunities for patients to be able to express themselves and any concerns or questions they might have. So as you'll see on the different graphs here, we were very successful in our project. As far as the three different clinics, cardiology, pulmonology, and then the cardiovascular thoracic surgery clinics, we went from 76.3% to 93.8% in 2 months. As far as our nurse listening score, which is huge improvement, 17.5%, and that's in total for all three clinics, so that's really great. Just offering that form, and it wasn't even the expectation that our nurses would have to write on that form. It was mostly to just present that form to the patient at the end of rooming the patient, getting their vitals, and doing kind of medication and allergy reconciliation, vitals, that kind of thing. Just providing that paper saying, to improve communication between our providers and our patients, we would like to offer you this form to give you an opportunity to write any questions or concerns down. And patients really took to it. They almost always grabbed the pen and started writing. Also, for all three clinics, we went from 70.5% to 93.8%, which is also a huge jump in patient experience, provider listened data. We improved 23.3% in 2 months. So really great. Just giving those patients that opportunity to review any concerns they might have and make sure that they feel heard by the provider. Many providers gave feedback saying they really loved it. It's a nice reminder for them at the end of the appointment to say, did I answer all of your questions? Let me look at your form here quick. And so it was very beneficial. As far as actions taken, we chose the project for this. And then because of the COVID-19 pandemic, we had to do a little extra checking, making sure that giving these paper forms to the patients would be okay. and giving them pen and paper. And then also if we wanted to use a clipboard, we spoke with infection prevention, and they noted that would be fine, but that we would use one paper per person. If they didn't fill it out, that we would throw that paper away, so that way they wouldn't be close contact with another patient. And also wiping down and sanitizing those pens and clipboards in between patient uses. We discussed the Dear Doctors forms with our staff at Daily Huddle, and we also kind of Sanfordized a sheet here, the Dear Doctor form, so that way we could have it on print and standby, and make sure it's nice and professional for patients to use. We talked about the benefits of using the form with our staff. Not only does it prompt patients to think of questions, it also finds out if patients need a medication refill that day. So taking care of it at that appointment versus waiting until they go home and say, oh, you know what, I forgot to ask for that medication refill. So just taking care of it right then and there really actually takes a little bit of load off on the nursing staff as far as like phone calls. Staff can write down any concerns that the patient notes during the actual kind of rooming process. If they say, oh, I've been having chest pain for a while, they might, ask a little bit more about that, put down a few of the details, and then that just takes one thing from the patient, makes them feel heard by the nurse, and also gives that information that's important to the provider. We went live with the Dear Doctor forms in August. We also worked on the verbiage for our staff, just like I kind of said, saying, when you're done with a rooming process, you say, this is something new that we've started. Tell the patient, this is to improve communication between our providers and our patients. We'd like you to just fill out any questions, health concerns that you might have, and then we'll review those in your appointment today. And patients, like I said, just grabbed the pen and started working away. And so we also gave verbiage to the providers, kind of having them say, I'd like to review your sheet with you before we end our exam today. I want to make sure that I've covered all your concerns for this appointment and make it worthwhile for you. And then on October, we created some signage, kind of trying to keep this Dear Doctor form on the forefront for staff, kind of reminding, saying, hey, we're still doing this. This is, a small thing we can do to help improve our patient's experience in their exam today. Next steps, I plan to continue to make the Dear Doctor forms a staple in our rooming process, and I'll continue to monitor patient experience data as a byproduct of this project. Thank you so much for listening to my project. Have a great day.